Good morning. So I'm gonna perform an easy PAP. So when doing it, make sure we check the patient's chart. So once we're done, before going inside to the patient's room, make sure we introduce ourselves. Tell the patient that this one is an easy PAP. This would help them clear up their airways, reduce any secretions, and prevent their lungs from any collapse. So with this one, make sure that we inspect it. If there are any cracks present, if there is, make sure we replace it with a new one. So there are two ports on it. So when using this one, make sure we demonstrate it in front of the patient, and make sure we also double check the patient's ID band for confirmatory purposes, and also we always do our vital signs and pre-assessment. Make sure we tighten this one up in this oxygen source. The other one is for the pressure monitoring port. If we don't use the pressure monitoring port because it is disposable, make sure we cover this one up to prevent any exposure from any ambient air. So when you hook this one up, you also hook this one other to the flow meter. Ideally, we start it with a flow of 5 liters and then we sense a sound. So with this one, the patient should position it like this, and they should not obstruct on the back because it's not ideal to block it. So when using a mouthpiece, make sure the patient would take a good seal with their mouth, with their tongue underneath, not blocking the mouthpiece. Make sure we also have an option of mask just in case the patient could not tolerate with this one. And then allow the patient take a good slow inspiration. Then after that, let the patient have a strong exhalation but not a forceful way. And then after that, let the patient rest, remove it, and let the patient cough. When using this one, it is also ideal that we start it in the lowest, such as not doing it more than 5 times to prevent any complications. And then if the patient does complain any complications such as dizziness, terminate the therapy immediately. And then with this one, we can also use it together with a nebulization treatment, because with that it would help restore and improve their lung volumes. So once everything is done, we always have to turn this one off, remove it, and then this manometer monitoring port should be disposed because it's disposable as long as we cover this one up. And then it should not be soaked in water, it should be air dried. And then with a mouthpiece or mask, it can be cleaned with sterile water, especially the mouthpiece, and it should be air dried. So once everything is done, also take note of the color, consistency, and amount of the sputum the patient expectorates. And then once done, we reassess the patient, reposition the patient from upright position. Once outside, chart everything, communicate with the staff, and also make sure we include it in the chart with how much the patient was able to reach this pressure monitoring port. And we're done.